Dr. Hudis, welcome. I'm so happy you joined us here at Rutgers Cancer Institute's annual Clinical Practice and Research Summit. We know each other for a long time. I'll refer to you as Cliff if that's okay. Just was curious, what was your impression from attending the summit today?
Well, the first impression I had was the scope and scale and organization of it. This is a big meeting, and the community has really been enriched over these years, even beyond what I had heard about, and it was impressive to see. And what I mean by that is depth in specific disease areas and breadth in terms of the number of diseases and disciplines represented. I think it's something to be very proud of.
Well, I very much agree. I just joined a few months ago, and that's the reason I came here. But I was equally impressed, quite frankly, because I've known you for so many years. I've been part of and have observed your career over many, many years. And today's presentation on ASCO and where it was and where it has come is astounding. I think many active members, such as myself, sometimes don't even know the depth of what's happening at ASCO and how it affects practice and our patients. One of the things you mentioned, though, you said that, of course, AI will be making a big impact on how we practice, and it'll be revolutionary. And I agree. You didn't get a chance to really speak too much to what ASCO is doing to be able to contribute to it and guide it in a direction that improves our patient care the most.
So first of all, I don't think today we can overstate the likely impact of AI on our field, and I don't mean that because it has such a special medical impact. I mean that because I think globally AI is transforming how we live and interact. And we've been through this before. I actually think it's reassuring to consider the internet revolution from the 1990s into the 2000s. There was this world before we were all connected, and then there was a world after. Before I go on, I want to remind everybody of the story. Through into the early 90s, there was business press about the elusive productivity gain that PCs were supposed to have delivered. We all had these computers running on our desks. We were using floppy disks. Everybody was working. We had the occasional blue screen of death and lost data and all of that stuff. But the real question from the business point of view in those days was, where is the productivity gain that we're supposed to be getting? Those discussions ended almost all of a sudden when the LAN and the internet were deployed, and no longer were the PCs disconnected silos, but in fact networked. Fast forward to this moment. What's happening right now is we have been building algorithms, and we've been building large language models, and we have been seeing the beginnings of AI both visibly and frankly invisibly in aspects of our lives. And I think a similar revolution is coming shortly for all of us. So in medicine, this should mean a number of things. First of all, we should be able to deliver relevant, cutting-edge, accurate, easily digestible information to all who need it at almost no marginal cost, because everybody's connected already. The second is those people will be expected to deliver the highest quality care wherever they are, but without limits. The people who are receiving care will rightly expect, because they have access to knowledge, that they will be able to get the care that is described. So for us at ASCO, we need to support this journey. We're not a tech company per se. We're not going to be ourselves creating artificial intelligence. The question for us is twofold. One, how will we best support and enable our membership as we go through this transformation? Teaching, providing tools, access, and the like. And the second is, how will we make sure that our information, after all, we are at root content curators and deliverers. How will we make sure that our information is made available for people in these tools? And without getting into too many details, I will say the following. We are laser focused on this right now. We've been working on this for more than a year, and we hope to be making, I think, exciting announcements in the years ahead. But I don't want to get ahead of us. We need to see what works. We need to see who we're collaborating with. We need to see how the systems are evolving. But I think that our members can count on seeing new opportunities for education and high quality care because of this transformation.
I have no doubt. You've done amazing work there. And just a quick question, because one other thing you presented at the summit here today is the spoke and hub model that you talked about. How does this dovetail on that? Is that part of what's going to also drive how we deliver care more remotely?
Well, I think in a way they're two separate issues. And what I believe about the AI revolution is that it's ubiquitous. So everything from how you drive your car, honestly, to how you book vacation travel, to how you interact with the healthcare system, they're all going to be altered by this AI revolution. And again, it's not hyperbole or science fiction. We've been through this before. We lived through this once already with the internet itself, so there's no reason to be alarmed, scared, or even shocked at what I'm saying. In fact, I'm sure I'm a late adapter, not an early one in the tech world. The hub and spoke issue really addresses a much more age-old problem, which is the distribution of physical resources. So what I think is that the AI revolution is going to elevate expectations, and the disparities that already exist could be worsened by that, or at least the recognition of those disparities. So then the question becomes a very practical, mechanical, logistical one. How do we make sure that everybody can actually access what we're recommending they get? And that's what the hub and spoke model in Montana is meant to demonstrate, that out at the so-called spoke site, the remote site, that using electronic communications and established network connections, that those clinicians out there are able, with guidance and support, to administer treatment, react to toxicity, support patients through their cancer journey, and save them all the hours and hours of travel for routine care.
Sounds very exciting for somebody like myself, and you've been doing this for a while, but more importantly, look forward to seeing more and more from ASCO with you in charge and leading the charge for the whole organization. I know it will continue to serve our patients and all the physicians and caregivers well. I hope we can see you again at Rutgers Cancer Institute in the near future.
Thank you very much.
It was wonderful to see you.
It really was. Thank you.